Hello, I'm Sandra Giuliano. I'm here on behalf of my colleague Shirley Poon, and we're the MDHS team improving nutrition in aged care. Currently in Australia, there are about 250,000 older adults in residential aged care, and this number is going to increase to around 1 million people by the middle of the century. What we know with aged care is they're meant to provide for all the care needs of the residents. Our particular focus is their nutritional care, because most, if not all, of the foods are prepared on the site, and residents consume food based on that prepared for them. During our research, we identified that the quality of the food was quite poor. This photo is actually a meal that is served during an evening, and this is relatively common of meals served in residential aged care. We also identified high levels of malnutrition, with 2/3 of residents being either malnourished or at risk of malnutrition, and this then leads to poor clinical outcomes. The clinical outcomes we focused on particularly are falls and fractures. So with our research, we identified that if we improve the nutritional quality of the foods provided to residents, that we could actually reduce the risk of these clinical outcomes. So it reduced falls and fractures in the residents. So before the TRAM program, we focused specifically on the nutritional quality of the food. So we saw the problem as being in the kitchen. And what we identified is that the chefs and cooks preparing the food lacked nutritional knowledge, and same with the food service staff. So for example, this is a meal that's provided in the evening, and I think if you can identify what it is, you're doing a better job than I am. So before the TRAM program, we focused specifically on the chefs and food service staff. And our initial thought was if we could educate them to prepare nutritious menus, then we could then solve the problem of poor nutritional care in residential care. As part of the TRAM program, we then mapped out the ecosystem, and we identified that there are a lot of players involved in the ecosystem, and that each of the players had their own unique set of problems with very little overlap between the problems. Furthermore, they didn't see nutrition as being part of their problem. So for example, the heads of the companies were more concerned with shareholder profits. Facility nurses were concerned with clinical care and drug administration, and the personal care assistants were concerned about getting residents dressed, showered, and ready for the day. So what we identified is that the problem of food quality extended beyond just the foods prepared. We could teach chefs to prepare the most nutritious foods, but if the system doesn't support that resident with consuming the food and having the food delivered to them, then all the work done in the kitchen is of no benefit to that resident. So part of our work, we identified the key players, but we did it across a breadth of different organisations. So our next step is to target specific organisations. In aged care, there are not-for-profits, religious groups, private companies, etc. And what we aim to do is to look at the problems at each of the levels within an ecosystem, because what we've identified is that the problems are slightly different depending on the organisation type. And by identifying organisations that require solutions to their nutritional problem, we then could help identify potential customers for our solution. So what we are seeking today is contacts with people that are in the aged care system, either directly in aged care itself at all levels, or people that are associated with aged care in terms of working with aged care providers. The other aspect would be people that specialise in training and education, because we're seeing that the education that we initially targeted just the chefs may need to extend to all the players, as what they don't realise is that each of their roles can influence the nutritional care of the residents. So there are our contact details, and we're happy to answer any questions. So thank you very much for your time.